So if someone is told by their provider that they have high cholesterol, what should their next steps be?
So the first thing that I do when I see somebody with high cholesterol is find out what the number is, right? So we have total cholesterol, we have good cholesterol, which is the HDL, and we have bad cholesterol, which is the LDL. At this point, most doctors only really care about that LDL, that bad cholesterol. So first thing I look at is, what are we talking about? A few points, 100 points, how big is that gap? 2, what is their kind of exposure? Are they really a toxic person? How old are they? Is there cardiovascular history in their family? And then I also will sometimes run what we call a calcium score. So if someone comes in, let's say they're 40, pretty young, but they've got high cholesterol, doctor wants to put them on a statin. Okay, let's go run and see how much plaque we actually have in our heart already. If we have 0 plaque, great. We don't have to worry about it as much. Take a little bit of time to kind of bring it down. If they have a lot of plaque already, let's say 40, then we may want to be a little bit more aggressive and maybe make some dietary changes, but probably do some supplements as well.
Mm-hmm. So probably somebody should see somebody like you,
yes.
Right? So like having in their wheelhouse
Correct.
somebody who's really familiar with working with this issue,
Correct.
Analyzing the blood work, being able to do blood work routinely to follow up on it at whatever sort of cadence you decide is right for them.
Yes.
I can speak from experience because my husband is that 40-year-old who we did a plaque test on, and thankfully looks amazing and has no plaques.
Right.
So we have some time to work and do natural things to get his cholesterol in check.
Yeah. And there's other blood tests that we can do as well. We typically look at LDL, but we also want to look at inflammation markers. We want to look at how sticky the blood is. So there's other markers that we might want to look at to say, is this really a concern, or is this just something that's there?
Yeah, and I think definitely to let patients know that they're not doing this alone.
Correct.
And that there are providers that can help, that in addition to their primary care, a naturopath or the cardiologist, and we're here to help.
Correct.